Hello, my name is Andrew, and today I'll be orienting you to the M4 Teaching Selective. All M4 students in the ECMH will be observed by their clinical preceptor during at least one teaching encounter. You will be observed for your skills in giving meaningful feedback to your M1 or M2 student based on the expectations you have set for the encounter. I'll tell you more about that later. First, the objectives for this orientation are to give you an overview of the teaching selective, a general reminder about the principles of giving effective feedback, as well as some information about creating a learning plan for yourself. The overarching goal of the teaching selective is to give you practice in giving feedback in a clinical setting. Part of this is to enhance your knowledge of teaching techniques as well as how to receive feedback on your own teaching skills. And by the end of this unit, you'll be able to demonstrate techniques for giving feedback as a clinical teacher. So first, I just wanted to show you the feedback form that will be completed by your clinical preceptor. We'll go over each section in more detail later, and you'll also be provided a copy of this that you can review prior to your observed teaching session. Now let's talk about how to give feedback. Much of this will be a review from our session with Walter Epic that we had in the fall. This diagram illustrates one model of how the feedback process works. What you'll notice is that the central and largest gear driving the feedback machine is setting expectations. In order to give meaningful feedback, the teacher and learner must agree upon expectations prior to starting the clinical encounter. As an example, let's say you're going to see a patient with abdominal pain. You're working with an M1 student who has learned the abdominal exam, but this student doesn't feel comfortable performing it. Before seeing the patient together, you tell your M1 student, "After we've completed the history for this patient, I'd like you to perform a complete abdominal exam on this patient. I will observe this part of the exam and give you feedback afterwards." Compare that scenario with what we're typically used to on the wards, where an attending will tell you, "Go see that patient and tell me what you learned." In our first example, with clear expectations, the student knows what is expected of them, and they will not be surprised by the feedback about something unrelated or out of left field. Your job as the teacher will be to observe the student and identify gaps in between their observed performance and what is expected. This will be the foundation of the feedback that you give to the student. Here are some things your clinical preceptor will be looking for when you are setting expectations. This step of the process can and should be negotiated with the learner. Ask them what they want to work on and try to tailor your feedback to a skill that they are currently learning or one they may just need more practice with. Here is another way of looking at the feedback process. Using our example from earlier, let's say we've just finished seeing the patient with abdominal pain. You observe the M1 student's performance of the abdominal exam and you're ready to discuss this with them. What now? The next step in the process is to elicit the student's own perspective on their performance. Here are some examples of open-ended questions you could ask to get the conversation started. For example, how do you think things went? What went well and what could have gone better? Is there anything in particular you feel you might need guidance on? Asking these types of questions invites reflection on the part of the student, which provides for a much richer, deeper learning and understanding on their part. Hopefully they will be able to identify their own performance gaps, but it is also important to elicit what they did well in the encounter. Now let's talk about how we can discuss the gaps in performance in a constructive, non-judgmental way. For this step, we'd like you to try using the advocacy inquiry model. The key to this model is to first make an objective observation about the performance. Give your point of view and then ask a question to probe for understanding. In our abdominal pain example, let's say that the student did not check for Murphy's sign in a patient with right upper quadrant pain. You might say to the student, "I noticed that you palpated all 4 quadrants and localized the pain to the right upper quadrant, but you didn't go further by checking for the Murphy's sign. I was thinking that that would be an important maneuver to elicit possible cholecystitis. I was wondering what you were thinking during the abdominal exam and if you thought to perform that maneuver. This is an example of a non-judgmental observation, but it also prompts the learner, the student, to think about why they didn't perform the maneuver, rather than just pointing out an omission and moving on. There are many reasons the student may not have checked for Murphy's sign. They may have simply forgotten, they may not have had cholecystitis on their differential, or they may not have understood the purpose of checking for Murphy's sign. Your feedback will be more meaningful if you tailor it to the reason why this step was omitted. Finally, to wrap things up, you will want to allow the student the opportunity to discuss their reasoning and thoughts related to their performance gap, and then work together as a team to close the performance gap. There are many ways this can be accomplished, which is part of the art of teaching. In our example, let's say the student responds that they know how to perform Murphy's sign, but they weren't thinking about cholecystitis on their differential while they were doing the abdominal exam. This might be a good teaching opportunity to discuss the pathophysiology of cholecystitis and how Murphy's sign can elicit pain in these patients. Or you could review the differential diagnosis for right upper quadrant pain. The important thing is not necessarily how or what you choose to teach, but that it is relevant to the performance gap and it helps close a gap in understanding on the part of the student. Now that we've discussed the feedback process, these next few slides just highlight things your preceptor will be looking for while you are giving feedback. You will be provided with a feedback form you can review prior to your teaching session. Again, these are just more sections of the feedback form that you can look over at your own leisure. This last slide summarizes the process for giving feedback to your junior medical students. First, you'll want to set expectations. As we saw earlier, this tells the learner what you will provide feedback on, and it creates a safe learning environment. It makes sure everyone is on the same page before moving forward with the learning activity, and it sets you up to give great feedback. Next, you'll want to give feedback. You'll reflect on the objectives and the performance and identify and close any gaps in performance. You can do this by inviting critical reflection, identifying performance gaps. Again, focus these on observed behaviors. Investigate the learner's frame of mind and close the gap in performance. Listen to what the learner tells you motivated their behavior. Use that information that they provide to close the gap between their intended performance and their actual level of performance. The final step involves creating an independent learning plan. Take the student, work on their gap, and determine how they will perform improvements and maintain those skills over time. Regarding independent learning plans, sit down with your junior student and identify a goal for improvement based on the gaps you identified in your feedback. Together, you can come up with an improvement goal, a plan for how to achieve that goal, and evidence for how it might be achieved. We suggest using the SMART mnemonic for writing goals. An example for our student might be, in the next 2 months, I will perform at least 5 observed abdominal exams and perform Murphy's exam in 100% of cases of right upper quadrant pain. Again, SMART goals are those that are specific, measurable, attainable, relevant, and time-bound. Here's some contact information if you have any questions about the teaching selective. You will be given more specific information from your preceptor about when and how the teaching observations will occur. Just keep in mind that your faculty preceptor will be using the same feedback process that you are using with your junior student to evaluate your teaching skills. At the end of the observation, you will work with your faculty preceptor to develop your own independent learning plan for improvement. Thank you for your time.